An elimination strategy helps protect lives and economics.
Mass vaccination programs for COVID-19 are continuing around the world. I'm on my way to get my first jab this morning. Yeah, seriously. But not every country can afford vaccines or can gain access to supplies, and many are not following public health measures. We're not sure why we're seeing more young people being hospitalised in America and Brazil. And in India, hospitals in many cities have run out of beds, with people even turning to the black market for essential medicines and oxygen cylinders. And we still don't have a clear picture of how well the current vaccines will block disease and if they will affect transmission.
Okay, girl.
Done.
You're done. Yeah.
Just like that.
Yeah.
So what's the future going to look like? I asked virologist Dr. Jeremy Rossman, whom we've kept in contact with throughout the pandemic. So Jeremy, is the SARS-CoV-2 virus here to stay?
Globally, yes, at least for the foreseeable future. But locally, it's possible to eliminate the virus. So we have two words that we typically use. We use elimination and eradication. And eradication is the sort of global elimination of COVID, and elimination is what can happen locally. So locally, absolutely, and we have good examples of countries and areas having already eliminated the virus. But globally, it's still going to be around, which means that even countries that have eliminated it have the chance that the virus will come back and they will have to repeat the process.
If the virus is not eradicated, it will become endemic, where it will continue to circulate the globe, with breakouts popping up over many years. We still don't know what immunity people will acquire through infection or vaccination. But that doesn't necessarily mean deaths and social isolation will continue at the levels seen so far. What will our future look like if the virus stays?
First of all, we don't really know what's going to happen because the virus is going to continue to change. And the more infections that there are globally, the faster the virus is going to be able to change and adapt.
And we've seen that already, with multiple new variants undermining successful responses. In Chile, despite having vaccinated faster than any other country in the Americas, with more than a third of the country having had at least one shot, cases have soared and lockdown measures are back in place. South Korea's public health management and stringent contact tracing early in the pandemic was admired, but there are real concerns a fourth wave is imminent. To understand what might happen in the future, Dr. Rossman points to two common endemic viruses circulating the globe.
So measles virus is incredibly contagious, even more contagious than the COVID virus. But we have a very good vaccine, and we've worked on getting cases incredibly low and eliminating measles virus from countries for many, many years. And so most countries have eliminated measles virus, but they occasionally have outbreaks because there is still measles virus in the world. So we haven't eradicated the virus, but we have eliminated it. And so that means everybody still gets vaccinated for measles virus. Now, in contrast, we have flu. And flu, we have a lot of cases worldwide every year, and the flu virus evolves pretty quickly. So this is why we constantly need a new flu jab. So we don't have a constant flu circulating in the country. We have seasonal epidemics. So what we're probably looking at is somewhere in between the two, depending on how strong we act. So if we act really strong, we might be able to get to elimination, like with measles virus, and then we just have to constantly, look and say, do we need booster vaccines? Do we need to, do constant surveillance to look for those little outbreaks and then respond? But for the most people in the majority of the country, it would be pretty much life as normal outside of an occasional booster jab. Now, if we don't get that case numbers down quite so much, then it might be more like flu, where we get a lot of cases probably in the winter.
Dr. Rossman was shocked more countries suppressed the SARS-CoV-2 virus rather than try to eliminate it. New Zealand decided to follow the elimination strategy and has had just over 2,500 cases and only 26 deaths. And one of the scientists who advocated going into lockdown early was this man, Professor Michael Baker, an epidemiologist who's part of the Pandemic Influenza Technical Advisory Group for the New Zealand Ministry of Health.
By the end of February, there was this remarkable report, and it was the WHO, a joint mission from them and China, that actually identified the fact that the virus had been stopped and contained in Wuhan. And this was really quite a remarkable event because pandemic diseases had not been stopped in this way before, not an intense respiratory pandemic like this. So that convinced me that actually we should be really looking at elimination. I actually assumed that the whole Western world would do that because the WHO team had identified that containment was possible and had been achieved in China.
Professor Baker says modelling showed that if left unchecked in New Zealand, the virus would have resulted in 12,000 to 13,000 deaths over 6 months or more in a population of almost 5 million.
There was this day really on the Monday, the 23rd of March, when the Prime Minister spoke to the nation and said, we are going to go to our highest level of containment as quickly as we can.
As of midnight Sunday, every person entering New Zealand, including returning New Zealand citizens and residents, will be required to enter self-isolation for 14 days.
The entire country was in an intense lockdown, and we spent 5 weeks in that lockdown and then 2 weeks in a lower level. It was a 4-tier system, so level 4 and then level 3 for a total of 7 weeks. And we emerged into a virus-free country.
Key strategies were border management, where all arrivals went into 2-week quarantine and still do. Later there was a use of masks, and that gave time to build up contact tracing. In the UK, in the early stages of the pandemic, officials decided to suppress rather than eliminate the virus, citing reasons including economic concerns. But Professor Baker says lives and the economy are intrinsically linked.
We analysed really a year of data from across the globe, published a paper in the British Medical Journal just before Christmas, and our conclusion was that actually elimination or containment, not only did it protect public health, it also protected economies, because what it does is it gives some certainty for business and other activities to resume. So countries pursuing elimination have 100 times fewer deaths typically, and but they also have a much less economic contraction. And in fact, some countries pursuing elimination have got net economic growth last year, and the economy is now recovering very well. And even in New Zealand and Australia, which are also pursuing elimination, we are experiencing much better economic activity compared with countries that are trying to live with the virus.
While New Zealand has been in and out of lockdown to contain small outbreaks, life has returned to normal. It's also been able to open a travel bubble with Australia. Globally, there's been a lot of discussion about implementing COVID-19 passports to prove you've had the vaccination before international travel. This already exists for diseases such as yellow fever, where certain countries require a proof of vaccination before entry is permitted. So Michael, if I can prove I've had the vaccine, will I be able to come home and see my family without having to go into quarantine?
I think there's a reasonable chance of that. Again, it just depends. We need to know more about how well the vaccine performs. But I think once vaccine coverage is at a very high level, and once we manage transmission across borders, not with quarantine, but with vaccination and potentially testing, we could get to the point where we really didn't need public health measures for this virus anymore.
New Zealand now has the luxury of rolling out the vaccine slowly, but hopes to have the entire population of 5 million inoculated by the end of the year. Because so few have had the virus in New Zealand, which means there's less immunity, will they be more susceptible in winter, which is fast approaching?
No, they're not going to be at a greater risk because they don't have that immunity in the population. They are going to constantly be at risk of small outbreaks that hopefully they can continue to respond to very effectively as they've been doing. Now, there is a chance New Zealand in their winter that cases will rise a little bit, that they're going to be at a little bit more of a risk because we are seeing more transmission in the winter. But again, it's the same thing that we've seen before, is that focused on elimination, then they can spot those cases quickly, they can respond well, and as long as they keep doing it, they'll still have little outbreaks, but they can still keep the virus overall eliminated.
While infections continue to rise, the virus is still considered to be in the pandemic phase. To become endemic, infections need to be constant over the years. But to reach that stage will depend on how quickly populations develop immunity, and that is unknown when each country has a different strategy.
So I and many other people are advocating for an elimination strategy because it helps protect lives and economics. It's costly up front, but overall, it's less of a cost and allows us to get back to some version of normal quicker.
It's finished. But don't worry, we've got a lot more Razor stories for you. All you need to do is like, comment and subscribe and hit the bell button below for notifications. We'll see you next time.